When someone is missing all of their teeth, I would say there's probably three ways to replace them. One of them is with a traditional denture. These teeth are totally removable, they move around. People complain that they're not able to eat or speak well with them in their mouth. The second way is a implant retained overdenture. That's when anywhere from 2 to 4 implants are placed into each jaw, and then we provide the patient with a denture that snaps on and off the implants. This gives the patient a little bit more retention, but at the end of the day, they're still walking around with removable teeth. To me, the absolute best way is to give this patient a full arch implant treatment that is not removable. So this is where we place anywhere between 4, sometimes even up to 8 implants into each jaw, and using those implants, we're able to secure a full set of teeth. They look and feel very natural to the patient. They don't move. The patient's able to eat whatever they want, and they have full confidence in their smile. So when a patient is missing their teeth and they have not restored their teeth with dental implants, this causes bone loss. Implants are great because they prevent the bone from resorbing. Removable teeth probably are less expensive initially, but over time, when you think about the many relines that need to be done, sometimes these removable teeth, they don't fit properly after a year or so the patient's getting a number of different dentures from different places. All of these costs are going to add up and can come very close to having a full set of teeth that are fixed with dental implants. It's better to get the implants done as soon as possible. That way you save yourself a lot of time and treatment time and money. Ultimately, if you're missing one tooth, a couple of teeth, or all your teeth, it's really important that we restore your smile with dental implants. So please give us a call and let us get you in for a consultation.